Hello everyone, I am Dr. Priyanka Sachdev here, NEET PG educator on Unacademy. I welcome you all for today's session. So today I am going to discuss a very important topic from MBBS point of view also and for the competitive exam preparation point of view also. So I'm going to teach you the treatment of diabetes mellitus. As we know, we have started this series, the integrated diabetes mellitus, in which we have already covered the pathology portion and medicine portion till now. We have covered the physiology portion, that is the insulin regulation. We have covered the anatomy and histology of the pancreas. We have covered the classification of various types of diabetes, the pathogenesis of various types of diabetes, especially type 1, type 2, gestational diabetes and various types of MODIs. Not only this, we have covered the clinical features of diabetes, the triple P. We have covered the complications of diabetes, diabetic ketoacidosis, hyperosmolar, osmotic coma. We have covered the pathogenesis of the complications. Right now it's time, or not only this, after that we have discussed the diagnosis of diabetes also, the blood test and the urine test. After that, now it's time to treat diabetes. Right, so how you treat diabetes, the pharmacology portion in the treatment of the diabetes mellitus. We all know for the treatment of the diabetes, two things are available in the market. One is insulin, the various types of artificial insulin preparations, and second is oral hypoglycemic drugs, oral hypoglycemic agents. Insulin is injectable. It is injectable. It comes in the form of subcutaneous injection. In case of emergency, we give IV also. One of the insulin can be given IV, but it is injectable. Whether it is subcutaneous or IV, it is injectable. It is injectable. Apart from it, we have tablets or capsules, that is oral formulation of treatment of diabetes also, which are known as oral hypoglycemic drugs or oral hypoglycemic agents. So I am going to teach you today in this lecture all about insulin and all about oral hypoglycemic agents, the classification, the mechanism of action, uses, adverse effect, pharmacokinetics, everything. So let me start with insulin. In the last lecture, we have already covered the classification of various types of artificial insulin preparations available in the market. So we have conventional insulin, we have monocomponent insulin, we have human insulin, and we have various insulin analogues, right? So what is the difference between them? Quickly we will see. So conventional insulin is prepared either from pig, that is pork, or either from cow or buffalo, that is beef. So we take their pancreas out. From their pancreas, we extract the beta cell, and from the beta cell, we extract the insulin. But this insulin is highly antigenic, highly allergic, because it is prepared from a animal which is non-human. It is prepared from the pork or beef, right? So here we can see the differences between human insulin as compared to pork and beef. We have discussed it yesterday. So human insulin have total 51 amino acids. 21 are present in alpha chain, and 30 amino acid are present in B chain, A chain and B chain. The same configuration is present in pork and beef also, but there are few differences. Pork differ from human by 1 amino acid and beef differ from human by 3 amino acid. So human insulin is more close as to pork as compared to beef. We have just seen this, and we have seen the exact amino acid where they are differing. So you have to learn this table. We have already discussed this table in the last lecture. Beef differs from human by 3 amino acid and pork differ from human by 1 amino acid, that we have already discussed. But these insulin are no longer produced. They are no longer used because they are highly antigenic. They are highly allergic, and now better forms are available. The second form are the monocomponent insulin or highly purified insulin. These are nothing, the purified version of conventional only. So we take the conventional insulin, prepare it from the pork or prepare it from the beef, we purify it and then use it in human. So still they are less antigenic as compared to conventional, but not the best. The best are these two, human insulin and insulin analogues. These are the best insulin. So nowadays these are also not used. We purify the conventional insulin before using in human. Purification is done by gel filtration or ion exchange chromatography, but they are not the best. The third are the human insulin. We prepare human insulin from human pancreatic beta cell by insulin gene, which is actual human gene, by genetic recombinant DNA technology. We have discussed this technology yesterday. We use a vector. We extract the target gene, that is insulin gene, from human. We combine the target gene with the vector. The vector is a plasmid. Then we inject the plasmid in E. coli or yeast, and we replicate the organism so that the gene is replicated, and with the help of transcription and translation, we obtain insulin, right? So, and last is insulin analogues. There are various types of insulin analogues. What are insulin analogues? Human insulin having same structure, exactly same structure as that of natural human insulin. This is artificial human insulin. It is same structure as that of natural human insulin. Now we will do some changes in this in this human insulin. So that changed form is insulin analogues. Actually, it is human insulin only, but few amino acids out of the 51 amino acids, some in alpha and some in beta change, we are changing something to add some extra properties. So insulin analogues are of 4 types. Based on the duration, these preparations are divided into not only insulin analogues, human insulin and insulin analogues are divided into 4 types. Total 4 types based on their duration of action, onset of action and duration of action. Rapid acting, short acting, intermediate acting and long acting. You can see rapid is ultra short. You can see rapid is ultra short. So you can learn like this. It is ultra short, short, intermediate and long. So 4 types of insulin preparations are available. You can see it is rapid, that is ultra short. It is short, it is intermediate and it is long. So these are the 4 types of insulin preparations available in the market. So rapid insulin, all rapid insulin, after giving the injection, they show their mechanism of action after 10 to 15 minutes. After giving injection, that is 0.2 to 0.3 hour, that is 10 to 15 minutes, right? And they act for 3 to 5 hours. Their duration of action is 3 to 5 hours. And short acting, they come in role after 30 minutes of injection and they remain their mechanism of action sustained for next 6 to 8 hours. Intermediate come in role for after 1 hour or 1 to 2 hour, right? And long acting come in role after 1 to 4 hour. So you can see based on their onset and duration of action, they are divided into 4 categories. Now you have to learn the names. This is the classification of artificial insulin available in the market and you cannot miss it, right? It is very ultra important topic. Please understand. So the 4 types of insulin available in the market is rapid acting, short acting, intermediate acting and long acting. It is based on their duration of action, onset of action and duration of action. It is divided into 4 categories. Rapid insulin. The rapid insulin are of 3 types: Lispro, Aspart, Glulicin. So we will make a mnemonic lag. Lispro, Aspart, Glulicin. The 3 types of rapid acting insulin. Have you got it? The 3 type of rapid. Short acting में एक ही है regular insulin. Only one. Regular insulin is the short. Intermediate में we have 2 forms. What are the 2 forms? Insulin zinc suspension, number 1, and neutral protamine hedged on, NPH. It is known as NPH. Protamine hedged on, that is NPH insulin, also known as isofen insulin. I will explain you all, don't worry. And long acting may we have 2 forms, Glargine and Detimer. Glargine and Detimer. These are the 2 forms in long acting. So please learn, make some mnemonics and please learn the various insulin preparations available in the market. You can see it is in front of you. So it is Lispro, Aspart, Glulicin. The first 3, these are the short acting, rapid acting, I'm sorry. Short acting may only one regular is there. Regular is short acting. Intermediate may we have 2, insulin zinc suspension and NPH. NPH is neutral protamine hedged on. Here we combine insulin with zinc. Here we combine insulin with protamine, right? So we are making some preparations from the natural insulin, human insulin, by combining it with some other substance. Long acting may we have 2, Glargine and Detimer. Glargine and Detimer. So here in rapid acting, all 3 have S. Lispro have S, Aspart have S, Glulicin have S. So S, all S containing are rapid acting. And here R, Glargine and Detimer, both have R. So all R containing are long acting. So like this, you can identify them in your option, one of the 4 options, right? So please that. So first I will teach you the short acting, regular insulin. After that, I will teach you the intermediate insulin, these 2, zinc wala or NPH. After that, I will come on rapid and long. In the end, I will teach you ultra short, rapid and long. So let me start with short insulin, that is regular insulin, right? Regular insulin, or it is short acting insulin, right? Regular insulin is an insulin which is at present at neutral pH. It is neutral pH. It is combined with small amount of zinc. It is slow in onset. It is not very rapid. It is short. So it is slightly slow in onset. It comes in role after 30 minutes of the injection. So once the person give the injection, subcutaneous injection of regular insulin, after 30 minutes, it will show its mechanism of action. And its mechanism of action will be remaining there for next 6 to 8 hours. For next 6 to 8 hours, it will remain. So it is coming in role after 30 minutes and its total action is sustained for 6 to 8 hours. So that is about regular insulin. This is the diagram of regular insulin. Can you see? You can see this yellow colored tissue is the skin. It is human skin. It is human subcutaneous tissue, skin and subcutaneous tissue. Okay. It is skin and subcutaneous tissue. So we are giving subcutaneous injection. See here, I am giving subcutaneous injection of this insulin at 90 degree. So this is the injection of insulin I am giving, the subcutaneous, below subcutaneous tissue, right? So here you can see the insulin. This is the regular insulin. This is the diagram of the regular insulin. In each regular insulin, you can see 1, 2, 3, 4, 5, 6. 6 molecules of insulin around each molecule of zinc. So in the center, there is one molecule of zinc. It is surrounded by 6 molecules. Hexamer 1, 2, 3, 4, 5, 6. The 6 molecules of zinc. 6 molecules of insulin. So in short, we can say that insulin forms hexamer with zinc. Like this it is forming hexamer. Can you see? This is a hexamer, it is a hexamer, hexamer, hexamer. Multiple hexamers are forming a they are combining with each other, so it is known as multi-hexamer. So when we give the injection, it is like multi-hexamer. From multi-hexamer they will split and they will form dihexamer. From dihexamer they will split and form monohexamer. From monohexamer, the 6 molecules 1, 2, 3, 4, 5, 6, they will separate and then they will be absorbed. So this absorption is very slow. This one is the fast. So it is somewhat between short acting insulin. It is short acting. It is not very rapid also. It is not very late also. So it is short acting insulin, right? So this one is rapidly absorbed. This one is slow absorbed. This one is very slow absorbed. So the cumulative effect of all this, it is short acting insulin. I hope I'm crystal clear in the concepts. This is the blood vessel of the person. You can appreciate this is the blood vessel. So how insulin, you are giving the insulin between the space in the subcutaneous tissue and the blood vessel. So here is the insulin. So first hexamer will form dihexamer will form monohexamer will form monomers, and then it will be absorbed. So it will be absorbed like in this space only. Mono are absorbed very rapidly and multi-hexamer are absorbed very slowly. So cumulative effect, it is the short acting. So with this diagram, your concept should be crystal clear. So we have learned everything about the regular insulin. Regular insulin is having neutral pH, so it can be combined with all preparation because it is having neutral pH. Its onset is 30 minutes. After 30 minutes, it come and roll, and it remain in sustained action. It is for 6 to 8 hours. For 6 to 8 hours, next 6 to 8 hours, it will show its action, right? It will show its action, and it is short acting. And here we combine the insulin with small amount of zinc, small amount. And mind my words, it is small amount, not large amount. Small amount of zinc we are combining, right? So that is about. What is the disadvantage? The biggest disadvantage is there. You have to give injection half hour before your meal, half hour to 1 hour. Now it is not very convenient for a busy life. Just suppose I am a diabetic person. I am on regular insulin. Regular insulin is a short acting insulin. I take my lunch at 2 o'clock every day. My lunch time. Now if I am on regular insulin, I have to take insulin 30 minutes or 1 hour before that. So I have to take insulin at 1 p.m. After 1 hour, I have to take the lunch. So it is very discomfort for the patient to take insulin injection 1 hour or half hour before, as compared to rapid insulin, the ultra short, in which you have to take injection just 10 minutes before the meal. Now just suppose my meal is getting ready. It is coming on the dining table. So before that, I will just give my injection, wash my hands, get ready for the meal. And it nearly takes 5 to 10 minutes. And in the next 5 to 10 minutes, I will take my meal. So it is more convenient for me to take insulin injection 5 to 10 minutes before as compared to take half hour or 1 hour before. So that is not always convenient for the patient, right? That is the disadvantage, right? So we take 3 big meals, 8 o'clock breakfast, 2 o'clock the lunch, and 8 o'clock in the night dinner. So 1 hour before that, you have to take this insulin 3 times or at least 2 times a day, because it is showing the action for 6 to 8 hours. So usually the patients who are on regular insulin, we give 2 injections, one at the breakfast, half hour before breakfast, and one at the dinner, half hour before dinner. And the duration between breakfast and dinner is almost, you can see, 12 hours. For 8 hours, it will give the cover, right? So usually we give this regimen. I will come on the regimen later on, right? To overcome this problem, we have created intermediate insulin. Intermediate insulin are of 2 types, the zinc preparation and NPH. I will come on both of them. Let me talk about zinc. Insulin zinc preparation known as Lente, and insulin protamine preparation known as NPH. I will come on both. So these two are the intermediate. Short से हम आ गए intermediate पे. Let me come on intermediate. यहाँ पे क्या problem था? The problem is that it is not giving the full coverage. It is giving coverage only for 6 hours, not for complete 12 hours with 2 injections. So for that we are coming on intermediate form. That will show its mechanism of action for 20 hours. So it will cover the entire duration between the breakfast and the dinner, I guess. Okay. So let me come, it is of two types, as I've told you, lente and protamine. Let me start with lente insulin. Let me start with Lentils insulin. It is known as insulin zinc suspension. Insulin zinc suspension. Here we use two type of insulin zinc suspension, the ultra lente and semi lente. What do you mean by that? Ultra lente and semi lente. What do you mean by that? Here the one with larger particle is crystalline and practically insoluble in water. It is long acting, and the other is smaller particle are amorphous. It is short acting. So we are using the different size of the zinc, right? So you can see here this one, and you can see here this one. The two type of insulin is used. This is the injection of insulin. It is containing two type of insulin. One is ultra lente, one is semi lente. In ultra lente, the insulin particles are large, so they are long acting. They will be absorbed slower. And in the another type, the molecules are smaller. It is semi lente. You can see this one is ultra lente. It is insulin molecule which is large, so it is slow acting, right? Long acting, slow acting. And this one, the semi lente, the molecules of insulin are small. They are small, so they are fast acting, and the combination cumulative effect of both of them is intermediate. So slow and fast, the combination is intermediate. Have you got it? So you can see it is monomer, ye monomer, monohexamer, and it is multihexamer. So you got my point. So two type of insulin we are using in a ratio. The ratio is usually 7:3. 7:3. So ultra lente plus semi lente is equal to lente. Have you got it? We have two types of insulin. Ultra lente plus semi lente is equal to lente. We mix them in a proportion 7:3 to make this combination. Ultra lente, the molecules of the insulin are large and crystalline, so they are slowly absorbed. That's why they are long acting. Here the molecules of this insulin are small. They are amorphous. That's why they are fast absorbed, and they are short acting. And the combination of the two, that is long and short, it is intermediate. I hope no one will give you this crystal clear concept. So that is lente. Whenever I am giving an injection of lente, it is intermediate acting because of this. The diagrams are crystal clear. So you can see ultra lente, you can see semi lente. Please everyone give me a thumbs up in the comment box if you got this point. So we are done with lente. We are done with regular insulin. We are done with lente. In regular insulin, we combine insulin with zinc. In lente also, we combine with insulin with zinc. Here also. Now we will combine insulin with protamine, not with zinc. We will combine insulin with protamine, and the preparation is known as neutral protamine hedged-on, NPH, also known as isophane. So isophane or NPH, I am teaching you. NPH. Here protamine is added in the same quantity which is suffice to complex with all insulin molecule. I don't have diagram for that. You can imagine the diagram by your own. So one molecule of protamine combined with one molecule of insulin. So it is forming complex. A complex is formed between the protamine and insulin. So all the insulin combined with the protamine. So protamine is added in the same quantity just to suffice forming complexes with all insulin molecules. Neither of the two is present in the free form. Neither protamine is present free nor insulin is present free. Both of them are forming complexes. Only complexes are formed. So on subcutaneous injection, when you give subcutaneous injection of such preparation, the complex will dissociate very slowly, and on an average it will give intermediate duration of action. So we combined it in that proportion. Have you got it? So here we are combining it with zinc, ultra lente and semi lente. Here we are combining the insulin with protamine. The motto behind combination of insulin with some other substance is that it should not be, if we give only insulin, it will be absorbed very rapidly. We have to combine it with someone so that it takes time to dissociate with that particular substance, either the zinc or protamine. So the action will be little bit longer and slower. The absorption is slower, so action is longer. Have you got it? So we are done with short acting. We are done with intermediate acting. Let me summarize till now. Now I will come on insulin analogues, rapid and long. Rapid and long पे अब आऊंगी मैं. Okay. So let me classify the short acting and intermediate acting. Short acting and intermediate acting. Short acting is only one. Intermediate acting are two. Short acting में only one is regular. Right? Intermediate में there are two. One is lente. One is isophane. Isophane is neutral protamine hedged-on, NPH, one and the same thing. Let me give you the details of all three. Short acting में regular है. After giving injection, it shows its mechanism of action after 30 minutes, and it remains sustained action for next 6 to 8 hours. Right? Here they come to, they both of them, they come in role after 1 to 2 hours. After 1 to 2 hours. But their action is sustained for 20 hours. Their action is sustained because they are intermediate acting. That is a summary, right? Here we combine the zinc, regular mein we combine the insulin with small amount of zinc. Small amount of zinc so that it takes time to get absorbed. Here in lente, we combine it with zinc only, but in two forms of the zinc, the ultra lente and the semi lente. In 7:3 proportion we combine, right? Ultra lente, it is the large molecules of insulin, so it is slow absorbed and long acting. Large, so long. Here semi lente mein, it is the small molecules of insulin, so it is short. So small, S for S, small for short, large for long. So we combine and make lente. What about isophane? Here we combine insulin not with zinc, we combine insulin with protamine. We combine them in 1:1 proportion, so none of them is free. One molecule of insulin combined with one molecule of protamine and they form complexes with each other. So it takes time when we give the injection to dissociate the complex. So on an average, they will give intermediate action. So that is the summary of the three in front of you. I have shown you three diagrams also, and this is the summary. Let me move on the other two insulin. What are the other two? Now I will teach you first rapid, and then I will teach you long acting, rapid and long, right? So let me start with rapid. The three type of rapid I will teach you, then the 2 or 3 type of long I will teach you. So short, intermediate are done. Is it crystal clear to you? Let me start now rapid insulin. Let me start the rapid insulin now. Rapid mein I will teach you 3 insulin: Lispro, Aspart, Glulicin. These all are human insulin. Now please understand, everyone first understand this diagram, then only I will start. So this is a diagram of human insulin. In human insulin, we have two chains, alpha chain. See here, this is alpha chain, and beta chain. See here, this is beta chain. In alpha chain, we have 21 amino acid. This is amino acid number 1, 2, 3, 4, 5, 6, so on. And total we have, you can see here total, this is 21. This is 21. So this is number 1. This is number 21 amino acid. In beta chain, we have 30 amino acid. So this is amino acid number 1, 2, 3, 4, 5. Likewise, we have, you can see, it is 30 amino acid. And both of them are combined with each other by disulfide bond. Alpha and beta chain are combined with each other by disulfide. So this is the diagram of human insulin. Now I will do some changes in that. Should I say the changes right now? Okay. So see the yellow color. Can you see? Yellow color is Lispro. यहाँ पे देखो Lispro है. Yellow color is here. Here is the yellow color. So I am changing beta chain के amino acid number 28 and 29. 28 or 29 पे I am doing some changes. So normal human insulin will get converted into Lispro. I will say what is the change. So first understand the diagram of human insulin. Then I will come on the 3 type of the insulin: Lispro, Aspart and Glulicin. Lispro, Aspart and Glulicin. The same diagram is shown here also. Okay, I will explain you. See, this is alpha chain. See, this is beta chain. Alpha chain have 21 amino acid. Beta chain have 30 amino acid. Both of them are connected with each other by disulfide bonds. Right. Now I will do some changes in that. Let me talk about Lispro. What is the change in Lispro? In Lispro, in beta chain we are doing the change, not in alpha. Beta के 28, total 30 है beta में. 30 में से 28 और 29 number पे we are reversing the proline and lysine. Okay, please see this diagram. I cannot zoom it. You have to see this diagram only. See, this is proline, this is lysine. So normal insulin में 28 number पे proline है, 29 पे lysine है. But I am reversing it. I am doing lysine on 28. See, and I am doing proline on 29. So normal insulin will convert into Lispro insulin. So in Lispro, only one change is there. That is, in beta chain on 28 and 29, I am reversing the order of proline and Lispro. Normally 28 पे proline है, 29 पे lysine है. But I am doing 28 पे lysine and 29 पे proline. So this will become Lispro. This is becoming Lispro. So I am reversing proline and lysine at 28 and 29 position of the beta chain. So normal insulin will convert into Lispro. By doing this, what will happen? You should ask me, ma'am, why you are doing so? ये करने से क्या होगा? By doing so, it will form very weak hexamer. Very weak. The hexamer will become, the insulin form hexamers with the zinc. Now, insulin form hexamers. So these hexamers will become very weak. So that's why they dissociate very quickly. Very quickly they will dissociate because they are very weak. They will dissociate super quickly. So they absorb very fast. That's why it is rapid acting insulin. So I am teaching you the rapid acting now. इसमें rapid acting के लिए I am doing some changes. So please say what is the change in Lispro? In Lispro, human insulin से एक ही change है. What is the change? The change is that in beta chain at 28 and 29, amino acid, you are reversing the order of proline and lysine. Normally it is proline followed by lysine, but you are doing lysine followed by proline. So because of doing this, you are weakening the hexamers. ये सब MCQs हैं. Please learn it. Coming on the next insulin. So what will happen? Since it is very rapid acting, human take 3 meals now. So 10 minutes before each meal, you have to give the injection. So you have to give 3 injections daily of Lispro. One here, one here, one here. Just 10 minutes before breakfast, 10 minutes before lunch, 10 minutes before dinner. So 10 minutes before, you have to give 3 injections for 3 meals, right? So it needs to be injected immediately before meal. And sometimes there is a, sometimes what happens, just suppose I'm a diabetic person. I'm very busy right now. So here is my lunch. I just started eating it before thinking that, no, I have to take injection of insulin 10 minutes before. I just forgot to take the insulin and I have already taken my meal. And meanwhile, in the meal, I have remembered, oh my God, I forgot my insulin. So after the meal also, I can take it. Immediately after the meal, during the meal, even after the meal, I can take it. That is the advantage. Have you got it? So meal time glycemia to ye control karega. But postprandial hypoglycemia, there is, nahi hoga. Okay. Intermeal duration mein there is no coverage. Have you got it? So it will cover this hyperglycemia here, here, here. But intermeal को ये cover नहीं करेगा because it is acting only for 2 hours. The duration of action is only for 2 hours. So in 2 hours, its action is over, right? And before the next meal, there is an intermeal period with it is giving no coverage. Have you got it? That is the thing. That is the thing. Coming on the next aspart. Aspart में only one change is there. Normal humans have beta chain के 28 number पे. Normal human being, humans have proline. But if I change this proline by aspartic acid, aspart, it is known as aspart. ये aspartic acid से आया है. Have you got it? See this diagram. Everyone see the green color now. This green color is aspart. Yellow was Lispro and green is aspart. Green कहाँ पे है? ये रहा green. See what is the change? See the change is at here 28 number. I'm sorry. The change is at 28 number. At 28 number, you can see normally it is proline. And this proline is replaced by aspartic acid. Now it will become aspart. Again, by doing so, there is weak hexamer formation and it will same as that of physiological insulin. Normal insulin physiological के जैसा उसका action हो जाएगा. Have you got it? Its action is same as that of physiological insulin. So we are done with Lispro. We are done with aspart. Lispro में 2 changes are there. Beta chain का 28 and 29 दोनों पे reverse कर रहे हैं. Aspart पे only one change है. Beta का 28, not 29. Right? Proline की जगह it is aspartic acid. Last is glulicin. Glulicin में again 2 changes are there. Glulicin. So again 2 changes are there. First change is at 23 amino acid of beta. Normally it is lysine. It is replaced by asparagine. Number one. And number 2 at 29 number. Normally it is lysine. It is replaced by glutamic acid. So 23 and 29. It is not shown here in this diagram. You can make it out. This one is 23 and this one is 29. यहाँ पे 2 changes करूंगी मैं. What are the changes? You have to learn by yourself. Asparagine is replaced by lysine here. Number one. And number 2, lysine is replaced by glutamic acid. This is 23. This is 29. So this is known as glulicin. This is diagram of glulicin. So glulicin में 23 और 29 पे 2 changes है. What are the changes? You learn by yourself. That is glulicin. So all these 3 insulin have to be injected 3 times a day, 10 minutes before every meal. That is the best part of them. Only 10 minutes before they have to be given, not much before. So we are done with rapid acting. The 3 rapid acting की summary दे देती हूँ मैं. What are the 3 rapid acting? Rapid acting insulin कितने हैं? There are 3 rapid acting insulin. What are they? Can anyone say? It is Lispro, it is aspart, and it is glulicin. Right? Glulicin. So what is the change in them? In all of them, changes only in beta chain. Beta chain का 28 and 29 number पे, beta chain का only 28 number पे, and beta chain का 23 and 29 number पे. These are the changes. Now what is the change? You learn by yourself, right? It's difficult for me to say the change, but I will try. Okay. Lispro में normally 28 पे, here it is proline, it is lysine. But if you are reversing lysine proline, it will become Lispro. Aspart में 28 number पे, it is proline. But if we replace the proline with aspartic acid, it is known as aspart, right? 23 and 29, normally 23 पे asparagine is replaced by lysine and 29 पे lysine is replaced by something, I forgot. So that is the difference. You can see, you have to learn by yourself. Everyone give me a thumbs up. I tried my best. Really, I tried my best to simplify the insulins for you, right? So that is rapid acting insulin. Now let me come on long acting, the last one, long acting. We are done with rapid, we are done with short acting, intermediate acting. Now I'm coming on long acting insulin. Let me come on long acting. Long acting mein we have two, glargine and detimer. So let me talk about glargine. Glargine mein we do two changes. Number one, at alpha chain, not beta. The alpha chain का last amino acid. Alpha में कितने amino acid हैं? 21. So at 21 number, normally there is asparagine. It is replaced by glycine. Number one. Number two. And in beta chain, we are adding two additional arginine residue in the end. Apart from 30. Beta chain में 30 की जगह 32 हो गए. So see the diagram. See the diagram. So that will become glargine. Glargine is this color, gray color. Okay, let me mark it. This gray color is glargine. Sorry, no, it is determined. I'm sorry. This pink color is glargine. Pink color. So where is pink color? Pink color is here and pink color is here. So can you see in alpha chain, it is asparagine replaced by glycine, number one. And in beta chain, these are the two arginine additional molecule after 30. 1 to 30 के अलावा 2 एडिशनल लगा दिया आपने. तो अल्फा चेन में आप 21 नंबर पे रिप्लेसमेंट करो. किसका रिप्लेसमेंट करोगे आप? किसका रिप्लेसमेंट करोगे? अल्फा चेन में एस्पार्जिन को ग्लाइसिन से रिप्लेस करो और बीटा चेन में 2 एडिशनल आर्जिनिन लगाओ. Have you got it? So that will be the diagram of glargine. So what is the advantage? It is long acting. By doing so, it will become long acting. It will act for 24 hours. So you have to give injection only once. You have to give only once injection at bedtime, not related to the meal. At bedtime. These long acting are basically for controlling intermeal, the basal blood glucose. Postprandial वाले को नहीं control करना है. So basically by giving rapid acting 3 times a day, you are controlling the postprandial sugar. And by giving long acting once a day at the bedtime. Usual bedtime is 11 o'clock for the patients, for the most of the persons. 10 o'clock, 11 o'clock, we should sleep. So the person is sleeping at 11 o'clock and taking the injection at the bedtime, and it is giving coverage for 24 hours, for next 24 hours. So next day again at 11 o'clock, he is taking the injection. So this is for coverage of basal sugar, and they give coverage only for 2 hours. So they are giving coverage for the postprandial sugar. So that is the basic concept. Have you got it? So I'm done with glargine. You have to give once a daily injection at the bedtime daily, right? And yeah, it is acidic pH. You cannot mix it with anyone. You cannot say कि मैम ये dinner वाले के साथ ही mix करके दे दो, the 2 injections. So injection एक ही बार देना पड़ेगा. The 2 you should mix. No, we cannot mix this. We cannot mix glargine with any one of them because it is acidic in nature. इस पे MCQ आता है. The next is detimer. In detimer, you are doing only one change. At 29 beta amino acid, 29 number beta amino acid, you are adding an additional fatty acid. The name is myristoyl. At the is attached to the B29 amino acid of the beta chain. Have you got it? So see this one. Okay, just a second. This is beta chain ka 29 amino acid. Uspe I am adding this fatty chain. This is a fatty chain. The name of this fatty chain is mysterol. The name of this fatty chain is myristoyl. So that is detimer. Have you got it? That is detimer. So detimer ka bhi yahi hai. So this is the summary. Should I draw all insulin in front of you? I will try. Okay. Insulin. Let me summarize insulin. Insulins are divided into 4 categories based on their onset and duration of action. The rapid acting are ultra short. The short acting, the intermediate acting, and long acting. The 4 types of insulin are in front of you, right? So rapid acting are 3. What are the 3 rapid acting? Can anyone enumerate? It is lispro, aspart, and glulicin, right? Long acting are 2. What are glargine and detimer? ये glulicin है, ये glargine है. Please don't get confused, right? Short acting is only one, regular, and intermediate are 2. What are the 2? Lente and protamine. Neutral protamine, H down, and pH. So please tell me the structure of each of them. Okay, I will try. At least I will try. Okay, you have to learn all these. I have given you a brief explanation, but I will try to explain, give you the summary. In regular insulin, we combine insulin with small amount of zinc. That's it. We combine it with small amount of zinc so that the hexamers become weak. right? In lente, there are two lente, ultra lente and semi lente. These are large, that's why long acting. These are small, that's why short acting. So the combination of the two will become intermediate. In protamine, NPH, we combine insulin with protamine. Protamine. Here we combine in 1:1. Here we combine in 7:3. So ultimately, complexes are formed and dissociation of the complexes take intermediate time. So that is the summary of them. Now coming on rapid and long. Rapid and long is difficult. In rapid, in Lispro, we do change in beta chain. Beta chain 28 and 29 number. In aspart, we do change in beta chain 23 number. And in glulicin, again, we do change only at beta chain 28 ki 29. I forgot. I guess it is 28 number. I guess it is 28 number. Please confirm it. Once, please confirm it. So these are the changes we are doing. So normally at beta chain 28, it is proline, it is lysine. We are reversing the order, lysine followed by proline. So it becomes Lispro. At 23, we have normally 23. We have what was it? It was having asparagine, but we are replacing it. We have lysine and we are replacing it with aspartic acid. So that's why it has become aspart. And in glulicin at 28, we have proline. And we are replacing it with someone. So please learn the changes by yourself. So it is like that. In glargine, two changes are there. One is in alpha ka 21 or one is in beta with two additional molecules of arginine we are adding after 31, 32. In datimer, we are adding an additional fatty acid. The name of this fatty acid is myristol at 21 number of the beta chain, 29 number of the beta chain, right? So please learn the specific changes. Maybe I have done some mistake here, but please forgive me for that. I try to explain you the best. So please learn these specific changes, and because of doing these changes, what property is changing? Either it is becoming rapid, either it is becoming long, either it is becoming long acting or rapid acting. So that is the summary. So I am done with the various types of structures of various insulin preparations. Let me teach you few of their properties. Give me a thumbs up, everyone. First in the comment box, drop a comment if you got the structure of all the insulin, and if you like the concept, the way I have taught you the various structures. Please drop a comment in the comment box. It is very precious for me. Give your feedback. Okay. Some special properties of various types of insulin: rapid acting, short acting, intermediate acting, long acting, right? Rapid acting mein we have seen Lispro, aspart, glulicin, right? All of them show their action after 15 minutes of the injection, and they are active for next 3 to 4 hours, right? Most rapid among them is aspart. Please learn, it is an MCQ. Most rapid among them is aspart. In तीनों में से most rapid is aspart. इस पे MCQ आएगा. All three are rapid, but rapid में से भी most rapid is aspart, right? That is about it. After that, come on short acting. Short acting mein we have two regular. Okay, it is regular only. Regular can be given IV. Only insulin which we can give IV in emergency. During diabetic ketoacidosis, we have to give insulin via IV route, not by subcutaneous route. Rest all are given by subcutaneous route. Only one insulin can be given IV also apart from subcutaneous, right? So ये subcutaneous भी दे सकते हैं, IV भी दे सकते हैं. Regular पे ये MCQ आता है. Come on intermediate acting. Intermediate are two, NPH and lente. NPH is isophane or lente. Nothing important about them, right? Come on long acting. Long acting, I have taught you three now. Add third name. I have taught you two now. Add third name in the classification. Glargine, datimer and digludac. यहाँ पे digludac भी add कर लो. Where it is? So please add the third name, digludac. It is a new insulin. It is also long acting. In तीनों में से longest acting is digludac. Glargine, only glargine is having acidic pH, so cannot be combined with others. So किस पे MCQ आएगा? Acidic pH glargine का है. IV to be given is regular, and most rapid acting is aspart. Most long acting is digludac, the new one. So please learn. See, it is 24 to 40 hours the duration of action. It is the longest acting. Shortest acting, longest acting आपको याद होना चाहिए, right? So add one more here, insulin digludac, right? The shortest acting among them is aspart, and the longest acting among them is digludac. Only one which can be given IV is regular, and only one which is acidic and cannot be combined with others, acidic pH, is glargine. In चारों पे MCQ repeated many times. I hope I am crystal clear in concepts, and you can do the revision of various types of insulin from my lecture. So here it is digludac, it is the longest acting, and unlike glargine, it can be mixed with others because it is having neutral pH, right? Lispro, Glulicin, Aspart all have S. Lispro have S, Glulicin have S, Aspart have S. So all S containing are short, not short, it is rapid acting, not short. Please don't get confused. It is ultra short, it is rapid acting, right? So Lispro, Aspart, Glulicin, these three containing S in their spelling, they are rapid acting. So from MCQs, you have 4 options now. You can pick it out, right? All insulin preparations will form hexamers. Only one rapid acting insulin are monomers, rest all form hexamers, right? All insulin preparations are neutral pH except one, glargine, which is acidic and cannot be combined with others. All other insulin are neutral pH. Please learn. All insulin preparations contain buffer. Name the buffer, it is phosphate or acetate, except regular, glulicin and glargine, which do not have any buffer. All insulin preparations given by subcutaneous route, only regular insulin can be given by IV also apart from subcutaneous. Please mind my words, regular can be given by both routes, subcutaneous also, IV also. It is not, it is given only IV. It can be given by subcutaneous also and IV also, right? There is one additional route of the insulin which was discovered few years back, inhalational insulin. It was launched in the market by the name Exubera. It was a revolution for the diabetic patients, right? So there is a company that Afrezza have launched this insulin, Exubera. In 2014, it was approved by the FDA, but it was seen by using this insulin, patient have high chances of having diseases like chronic lung disease and asthma, so it is withdrawn from the market. Now it is not available. So only 2 routes for the insulin. What are the 2 routes? Maximum it is subcutaneous, only regular can be given IV also. So these are the 2 routes of the insulin. These are the 2 routes. Now tell me the site. कहाँ पे insulin देना है? Sites. Where are the sites? This is anterior of the body. This is posterior of the body. So name the sites where it can be given. It can be given on the arms, number 1. It can be given in the thigh, lateral aspect of the thigh, anteriorly also, posteriorly also. And it can be given, this is the umbilicus, 2 centimeter छोड़ दो, 2 centimeter की border छोड़ के, it can be given in the entire abdomen. It can be given in the entire abdomen, leaving a border of 2 centimeter. So how to give it? These are the sites, right? How to give it? It has to be given subcutaneously by forming a fold. So if I'm giving it to myself, here on the arm I can give, I will make a fold here, and give it. Now giving at the arm or is difficult for the patient if it is given by the self. But if someone else is giving the injection, it is like making a fold. But patient, this is like in the arm. Can you see? It is given at 90 degree by making a little bit fold. You are giving it subcutaneous. But giving in the abdomen is very easy for the patient. Can you see? Patient herself or himself can give in the abdomen by making a fold. You have to leave 2 centimeter rim around the umbilicus and give it anywhere, right? Now factors which affect insulin absorption. It is the site of injection. It is most rapidly absorbed from abdomen and followed by arm, buttock and thigh. Most rapidly absorbed from abdomen with best absorption hoga. So best absorption is from abdomen, right? Type of insulin. So fast absorbed are regular, aspart, lispro, glulicin. Subcutaneous blood flow. So before giving injection, do massage here. Do massage to increase the blood flow. Do massage here. Do massage. Head with the hand, do a massage to increase the blood flow. By massage or hot bath or exercise. Then give the injection. So absorption will be fast. And depth of injection. You have to give it subcutaneous. You don't have to give IM, intramuscular. So just subcutaneous के नीचे muscle होता है. You don't have to give deep injection into the muscle. No, you have to give subcutaneous. If you are given intramuscular, absorption will be very fast, right? Now, what are the last thing? What are the adverse effects of the insulin? Does insulin have any adverse effects? Yes, insulin have 4 adverse effects. The most dangerous about it of insulin adverse effect is hypoglycemia. If we give large doses of insulin, patient can go in hypoglycemia. It is the most frequent and potentially the serious side effect, right? Patient can go in hypoglycemia if he has taken large doses of insulin, if he has missed a meal after taking the injection, or after taking insulin if the patient is performing exercise. So patient can go in hypoglycemia. It is an emergency, right? During hypoglycemia, the sympathetic stimulation will be there, because of which patient have palpitation, anxiety, sweating and tremor, right? Patient will have sweating, shaky hands, that is palpitation, and anxiety and tremors will be there, right? Now brain is getting less blood. Brain is getting less blood or less glucose, right? Less glucose, because the patient is in hypoglycemia. So patient will feel dizzy, confused. Ultimately patient can go in coma and patient can be dead. Patient can be dead within few minutes. It is an emergency. So whatever sweet thing available in front of you, please give the patient to eat it as soon as possible, and warn your patient. Whenever you are giving insulin to any of your patient, warn that whenever you have these symptoms, please eat whatever available in front of you, whatever eatable sweet thing available in front of you, the chocolate, the pastries, anything, the glucose, please take it. And you always keep some sweet thing in your purse, in your pocket, always. Wherever you are going, please keep it. You can go in hypoglycemia anytime, right? So you should instruct your patients accordingly, right? Now, some patients have hypoglycemic unawareness, about 30% of the patient, due to diabetic nephropathy. Now it becomes very difficult for them. What is the treatment of hypoglycemia? Give glucose orally. If the patient is conscious, give it orally. And if the patient is unconscious, you give it IV. You give it IV. The patient can go in coma also, so give it IV. And after that, give glucagon. Glucagon will reverse the effect of insulin. Right? That is the emergency. After hypoglycemia, the second side effect is local reaction. Local reaction. Patient can have swelling, stinging, erythema, or lipodystrophy at the site of injection. So patient has to take daily 2 or 3 injections. So we can see daily 2 or 3 injections taking at multiple sites. Patient have lipodystrophy because the injections are given in subcutaneous tissue, right? And patient can have erythema and pain in the injection site. Allergy. Some patients can have urticaria, anaphylaxis, allergy with insulin injection. And some patient can have edema. Some patient can have edema due to sodium retention. Insulin causes sodium retention, right? So edema ho sakta hai. So these are the adverse effects of insulin, the 4 adverse effects: hypoglycemia, local reactions, allergy, and edema. Drug interactions you can learn by your own. The uses of insulin we all know. In diabetes. In which diabetes? Type 1 or type 2? In all forms of type 1, insulin is the only treatment. What about type 2? In type 2, you have to give only when it is not controlled on OHA. Otherwise, first try OHA, oral hypoglycemic agents. If it is not controlled, then give insulin. In pregnancy, directly give insulin. If a pregnant lady is having diabetes, don't try oral hypoglycemic agents. Directly give insulin, right? In complications like diabetic ketoacidosis and hyperosmolar coma, don't try oral hypoglycemic agents. Directly give insulin. And if the patient is tiding over some stressful condition like surgery, burns, or any infection, give insulin. So these are the 4 criteria of type 2. So insulin indications, if you talk about, so you give insulin to all patients of type 1, all patients of type 1 without any exclusion. In type 2, you give only 4 patients. Number 1, if it is not controlled by OHA. Number 2, the patient is pregnant. Number 3, the patient is tiding over some stressful condition like burns, infection, surgery, right? Or the patient is, what was the 4th thing? I just forgot. The 4th thing, the patient is in some complications of diabetes, ketoacidosis and hyperosmolar. Now, the last thing, let me teach you the regimen, the 2 regimens of the insulin. What are the regimens? Now, you have various types of insulin available with you. You have rapid acting, short acting, intermediate acting, long acting, right? The 3 rapid acting, 1 short acting regular, 2 intermediate acting, lente and isophane. The long acting you have various types of insulin available with you. Which insulin you will offer to your patient and how many times a day? That tell me a regimen for giving the insulin, regimen. So there are 2 famous regimens. I will teach you both. The first regimen is split mixed regimen. Split mixed regimen. So what you are doing here in split mixed regimen, you are giving which 2 insulin? You are giving short acting and intermediate acting. You are not giving rapid and long. You mix short and intermediate. You mix regular insulin with NPH. Regular is short and NPH is intermediate. So you mix together. See here, I am mixing regular insulin with NPH in 1 injection only. I am taking 1 injection, putting regular insulin also and NPH also. So 1 time I am injecting. Injection bar site एक ही है. Injection एक ही बार देंगे लेकिन जाएगा दोनों. Have you got it? So we are mixing regular insulin with NPH, that is short and intermediate. Short and intermediate. And we are giving 2 injections daily. 1 before breakfast at 8 o'clock, right? And 1 before dinner at 8 o'clock. So 12 hourly we are giving. 8 o'clock in the morning, 8 o'clock in the night. We are giving it. This is before breakfast, just before breakfast, 1 hour before breakfast. This is 1 hour before dinner. We are not giving anything at the lunch. So that is the thing. So regular insulin, that is short acting, will take care of the postprandial hyperglycemia, right? And intermediate acting, that is NPH, will take care of the intermeal, the basal sugar. So that is the purpose of salt. Have you got it? So we take 3 meals now. So you give 2 injections to the patient. Ask the patient to take breakfast, lunch, dinner. First injection, just the medicine which is available, it is already a mixture of the two, that is regular and NPH. Ask the patient to take the medicine in the injection, in subcutaneous injection. Take first injection 1 hour before breakfast, half hour before breakfast, and second half hour before dinner. So patient has to take 2 injections daily, right? 2 injections. You have to mix the two things, that is regular with lente, either lente or isofin. किसी के साथ भी कर सकते हो. This is NPH and this is lente. Both are intermediate. This is short acting, these are intermediate acting. You mix the two in 50-50. In 50-50. Give 1 injection before breakfast, 1 before dinner. That is the most famous regimen we follow, right? If you have any diabetic person at your home, at your neighborhood, in your hospital, and the person is on insulin, you can ask the regimen कि कितनी बार injection लेते हो और कौन सा लेते हो. The second regimen, the advantage is that the patient has to take only 2 injections daily. Only 2. 2 is less number. And lunch पे आप कुछ नहीं ले रहे. So post lunch hyperglycemia, there is nothing to cover it. So lunch पे जो hyperglycemia होगा, there is lunch भी, patient is taking lunch also. So lunch पे जो hyperglycemia है, उसको cover करने के लिए कुछ नहीं है. So that is a disadvantage. So one advantage, one disadvantage of this regimen. Coming on second regimen, basal bolus regimen. Basal bolus regimen में, this is the regimen. Patient will take 3 rapid acting, 1 before breakfast, 1 before lunch, 1 before dinner, and 1 long acting at the bedtime. सोते समय. So total 4 injections daily. 4 injections daily. Listen. In the first regimen, that is split regimen, patient was taking 2 injections, which is a mixture of the two, of the short and intermediate. Here I am saying at the 3 meals, patient is taking 3 injections. At breakfast also, lunch also, dinner also, 10 minutes before breakfast, 10 minutes before lunch, 10 minutes before dinner. So 3 injections to iske ho gaye. And last, the 4th one, the long acting at the bedtime. You cannot mix them with this. Have you got it? So 4 injections. You cannot mix Glargine, but you can mix Detamir and Degludec. So ये दोनों आप mix कर सकते हो. So 3 to 4 injections. ये last वाला injection you can mix it with the dinner. Not Glargine, लेकिन other 2 you can mix. So 3 to 4 injections patient को लेने रहेंगे. Here in this regimen, the rapid acting will take care of the postprandial hyperglycemia and long acting will take care of the basal. यहाँ पे short acting was taking care of the postprandial hyperglycemia and intermediate one was taking care of the basal, right? You have to take care of both. Have you got it? Have you got it? So this is basal bolus regimen. See, the patient is given 3 injections. 3 injections. 1 at before breakfast, 8 baje. 1 at before lunch. This is before lunch and this is before dinner. 10 minutes before breakfast, lunch, dinner. So the postprandial hyperglycemia of breakfast, lunch, dinner is covered by the short acting. You are giving short acting, any short acting. Aspart you are giving, Lispro you are giving, you can give anyone. And 1 you are giving at the bedtime. See, this one I am giving at the bedtime at 11 o'clock. So it will act for the 24 hours. ये सुबह के 6 से next सुबह के 6 है. So it is showing action for the 24 hours and next 24 hours you have to give the next. So total 4 injections you are giving. Give me a thumbs up if you got it. Everyone give me a thumbs up. Everyone. So there are many MCQs based on it. I have taught you insulin completely. In insulin, I have taught you the various type of preparations available, the classification of various types of insulin, rapid acting, short acting, intermediate acting, long acting, the structure of various types of classification of the insulin, उन सबका structure क्या है, their various properties, which is fastest, which is slowest, which can be given IV, which is acidic, which is neutral, so their properties. After that, I have taught you the 2 regimens. What are the 2 regimens? Split regimen and basal bolus. So कौन सा हम किस में use कर रहे हैं? The uses and the adverse effect of insulin. We are done with insulin. You want to do some MCQs? Yes, definitely you will love to do it. So this is the first question in front of you. You tell me what is the correct answer in the chat box. Please write down. Crystallization and storage of insulin requires which iron? Which iron? Is it require manganese, zinc, copper, ki calcium? As we all know that zinc form hexamer with insulin form hexamer with zinc. So the correct answer here is B and you all are correct. Have you got it? This is the next question in front of you. Which of the following insulin can be given IV? As I have told you, only one insulin can be given IV. Is it protamine zinc insulin? That is NPH. Is it ultra lente? Is it semi lente or is it regular? What it is? So yes, you all are correct. The correct answer is D. It is regular insulin, the only insulin which can be given IV. Right? Which of the following is not an insulin analog? Not an insulin analog. Please read the 4 names. Insulin analog में rapid आ जाएंगे. There are 3 rapid and there are 3 long. टोटल 6 इंसुलिन एनालॉग्स हैं. व्हाट आर द थ्री रैपिड क्या हैं आपके? लिस्प्रो, एस्पार्ट और ग्लूलिसन. लॉन्ग एक्टिंग में ग्लार्गिन, डेटिमर और डेग्लूडेक. So these are the long acting. So it is glargine, ये तो है. Glargine is the long acting. Lispro is a short acting, and aspart is also a short acting. But atropid is not the answer. Atropid is the combination of regular and NPH, as I've told you, which we give in split regimen. उनके combination को atropid कहते हैं. So it is not a analog. So correct answer is C. Have you got it? Okay, this is the next question in front of you. All of the following are short and rapid acting except. The question contains except. So you tell me the answer. Lispro. Lispro is rapid acting. It has S. Aspart, it also has S. It is also rapid acting. Now the confusion is between glargine and glulisin. Glulisin also have S. That's why it is also rapid acting. But glargine is a long acting. Glargine, Detemer and Digludec. These three are long acting. So answer is C. Because except is asked in the question. So correct answer is C. Have you got it? Okay. The next question is in front of you. Please tell me what is the answer. You will be able to tell me. Long acting insulin is. Which among the following is a long acting insulin? Who will tell me? Is it Glargine? Is it Lispro? Is it Aspart? Or is it Glulisin? Which is a long acting? Which of the following is a long acting insulin? Anyone? Long acting कौन सा है? इनमें से long acting insulin. Which one is the long acting? So long acting is Glargine. R for R. The next all contains S, S, S. So S containing are short. So A is the answer. Right? So you learn rapid acting and you learn long acting. इस पे बहुत MCQs आएंगे. Rapid acting all S containing, long acting all R containing. Lispro, Aspart, Glulisin, Glargine, Detemer, Degludec. So you have to learn. Which of the following is in intermediate acting? Intermediate acting में दो होते हैं. कौन सा intermediate? Yes, you should know the classification. Come on. Lispro, it is a rapid acting, right? NPH, regular is short acting. Glargine, it is long acting. But NPH is intermediate. So intermediate में दो आएंगे, NPH and Lente. So correct among them is C, right? So these are the questions in front of you. Which of the following insulin never mixed with other? Never mixed with other. What is the answer? Is it Lente, Aspart, Lispro or Glargine? Which is never mixed with other? So answer is Glargine. The reason is that it is acidic pH. It is having acidic pH. Rest all have neutral pH. So we can mix neutral with neutral, but we cannot mix acidic pH with some neutral. So that is the reason. Correct answer is D. Have you got it? Okay, this is the next. All of the following preparation of insulin are rapid and short except. So Lispro is short, Aspart is short, NPH is intermediate. I will go with Glargine. Now this is rapid, this is long, and this is intermediate. So answer क्या बोलोगे? Now this is confusing. Both of these is the answer. Both of these are not rapid and long or rapid and short. But still I will go with Glargine. This is the best answer I can give. Which is the most common route for insulin administration? Most common is subcutaneous. But regular insulin can be given IV also. That is a different thing. But most common route is subcutaneous. Have you got it? Okay. Human insulin as compared to beef or pork insulin is it more potent, rapidly absorbed, longer acting, ki more antigenic? Yes. So yes, of course, it is rapidly absorbed. Okay. So that is the thing. Insulin having longest duration. Which insulin have longest duration? Is it isofin, protamine, insulin zinc or plain insulin? Which insulin have longest duration? Longest किसका होगा? तो इंसुलिन को जिंक के साथ कंबाइन करोगे कि इंसुलिन को प्रोटामिन के साथ करोगे कि आइसोपेन? So when we combine, NPH is the longest among them. You know the duration of action of them, right? So I am done with the insulin. I hope the concepts are crystal clear to you, and I should stop here as the link is expiring. I am done with the insulin. If you have any doubt regarding this lecture, don't forget to write in the comment box. I will definitely address it. Thank you very much for being with me. If you like the video, don't forget to click on the like button. Please subscribe our YouTube channel and share the link of the YouTube and the video with your friends, colleagues, all your batchmates, and ask the friends to share. Ask your friends also to watch it and download the app. Download the Unacademy app. Now there are two important announcements for you. On Unacademy, we are offering 20% discount on all subscription, whether Plus or Iconic. On all subscription, the offer is valid from 14th to 16th March. So today is the last day of this offer. Please grab the offer and get your subscription. You can use my code Sachdev10 to get this opportunity. SACHDEV Sachdev10 is the code, right? On Unacademy, the second announcement is that we are conducting a combat test that is going to happen on 20th March at 12 p.m. Please make a reminder, schedule a reminder for that. Total 40 questions, 60 minutes time. The topic is cardiovascular system, and the rankers will get various scholarships and the Amazon gift vouchers. So you can be the winner. So why don't you try your knowledge as well as your luck, right? So on Unacademy, we have two types of subscription. In Plus subscription, you will get access to live and recorded lectures of Unacademy only. In Iconic, along with Unacademy, you will get access to the prep ladder also. So whatever subscription you want to take, it's your choice. You can take it. Once you take the subscription, you will be eligible for all these batches, to attend the lectures in all these batches, right? These are the various plans in the Plus. These are the various plans in the Iconic. The plans are in front of you. In Plus, the minimum is 3 months, maximum is 4 years. In Iconic, the minimum is 6 months, maximum is 4 years. And if you apply my code is SACHDEV Sachdev10 before payment. If you apply this code before 16th of March, you will get 20% of discount. And after that, you will get 10% of the discount. And price hike is coming soon. So be fast, grab this opportunity. Thank you very much for being with me. In the next lecture, I'm going to take oral hypoglycemic agents. So don't forget to attend that lecture. Bye-bye. Study hard. I'm ending it.